John is helping doctors find a cure for his cancer. Like 1 in 5 UK cancer patients, he's taking part in a clinical trial.
Clinical trials involve patients in medical research. We need clinical trials to develop new treatments for the future to make sure that we can offer patients the best possible care. That might be new drugs, it might be radiotherapy, surgery, and we also look into prevention and the causes of cancer.
I found out about the trial towards the end of my course of radiotherapy and chemotherapy, and the oncologist that was treating me asked me if I'd like to take part. It seemed to be a very sort of logical thing to do, and frankly, after a diagnosis of serious cancer, if you're given the opportunity of taking part in something which may, however small the chance is, result in your cure, really, is there any reason why you shouldn't do it?
To be sure taking part is right for you, your doctor will explain the trial and your role in it. You'll get plenty of information, which includes how patient welfare is protected.
Before a trial comes to the point where patients are entered, it's reviewed in great detail by researchers and other professional experts. And it goes to an ethics committee, which is made up of specific professionals but also members of the public, so that they can review it to make sure that it's in the best possible shape before it's offered to patients.
When Annie decided to take part in a clinical trial, it wasn't just her own treatment she hoped would benefit.
To take part in a research trial, which could help somebody else who comes after you, can be the positive experience that you have in the midst of this otherwise dark time. I certainly was aware that the treatment that I was being given was only possible because of women before me who had agreed to take part in clinical trials. And so there was an emotional side of me which said, it is right that you should take part in this, and this is your legacy to the women who will come after you.
But not every trial is suitable for every patient.
There's certain entry conditions before patients can take part in a trial. This might be their age, it might be the type of cancer they've got, it might be the stage of the cancer they've got, and that's to make sure that the group of patients who take part are as similar as possible, so that when the data is collected you're looking at very clear indications of the type of cancer the patient's got and how the treatment affects that.
Once you've joined a clinical trial, you're usually assigned a research nurse.
That nurse acts as a kind of a key worker for the patient. They'd be their first point of contact for any concerns, whether it was tests they were having, side effects if they didn't feel well, down to very kind of small things but that are very key to patients, like where they park at the hospital, who pays for the parking, what their travel costs are, and the research nurse would sort all that out.
So what might be the drawbacks in taking part?
There may be other tests that you have to undergo. More blood samples, for example.
You are reminded in my case, every 6 weeks or so, that you have cancer. You come back into a hospital environment, but it's only for a few hours, and after you've done it a few times, it passes very quickly, and you leave the hospital with a slight skipping of step, because you know you've been checked over thoroughly and you're clear.
But what happens if you change your mind and want to leave the trial?
If a patient wants to leave a trial at any point, they can. The research nurse would organise that for them, and they then move back into the normal care that would be offered for their type of cancer with no problem.
Before you decide, here are some tips from John and Annie.
First of all, do ask questions and keep on asking questions until you get an answer that you're satisfied with.
Look into the trial itself, understand what it's trying to achieve. And I think you have to be happy that you support that as an aim.
Take your time to think about it. You don't have to make the decision there and then. You can take it home and think about it overnight.
And, well, really the downsides are so small by comparison to the potential benefits. My advice is just do it.
For more information or to find a cancer trial, go to our trials database.